Many thanks for connecting to my channel. My name is Okafor Luke. I'm a clinical pharmacist and pharmacy director. Today, we have an essential topic to discuss: hypertension, the promoter of cardiovascular and related diseases. Do pay attention to the explanation of hypertension, signs of hypertension, risk factors, complications, prevention, and management of hypertension. This discussion is simply documented because I don't want you to miss anything. What is hypertension? Hypertension is a condition where the pressure or the force of blood against the walls of the arteries is consistently elevated or too high. This pressure is measured in millimeters of mercury and is expressed as two numbers representing the systolic, which is the upper number, and diastolic, which is lower number. The systolic pressure is the maximum force on the walls of artery when the heart contracts and pumps blood into the arteries. The diastolic is the pressure that has been exerted on the walls of arteries when the heart is at rest at beating intervals. Consistent blood pressure can strain the walls of arteries. This strain can lead to development of cardiovascular challenges or complications such as heart disease, strokes, and peripheral arterial disease. Over time, this can damage the blood vessels and lead to serious health problems. It is essential to know the normal blood pressure range and categories of hypertension so you can identify if you are at risk. Normal blood pressure is typically the value, a mean value, that's average of 2 or 3 readings, less than 120 over 80 millimeter mercury. Readings consistently above 120 over 80 are considered hypertension. Hypertension is categorized into 3 main stages. Stage 1 is 130 to 139 over 80 to 89. Stage 2 is 140 over 89 over 90 or more. Stage 3 is called hypertensive crisis. Stage 2 and 3 are threats to heart functions. Hypertensive crisis is a medical emergency that occurs when there is severe and sudden rise in average pressure reading that show consistent systolic and diastolic pressure of equal to or above 180 over 120 millimeter mercury. This crisis can lead to life-threatening health challenges, including death after a few years of crisis. Hypertensive crisis is related to hypertensive emergency associated with new or progressive end organ damage involving mainly the kidney, the eye, the heart, or the brain of adults, especially within the ages of 60 to 85 years. According to World Health Organization, it is estimated that 1.13 billion people globally are hypertensive, accounting for approximately 25% of global adult population. Unfortunately, many individuals are not aware of their hypertension status. And this is the importance of this public awareness campaign or creation. So tell everyone what you have learned from this video, because the information here will surely help them to partner in the health care of their hearts. According to World Health Organization, only about 46% of individuals with hypertension globally are aware of their condition, and less than 20% have their blood pressure adequately controlled through treatment. Signs of hypertension. Hypertension is commonly regarded as silent killer disease because it shows no early signs or symptoms and can go on undetected for a long period of time, leading to complications or challenges. Its identification is usually through screening or when seeking health care for an unrelated health problem or problems. However, a proportion of people at later stages of high blood pressure present a combination of more than two or of these signs or symptoms. They include severe headaches, which happens behind the head, especially in the morning, nausea and or vomiting, light-headedness or dizziness, vertigo, which is sensation of imbalance, tinnitus, which is buzzing or hissing in the ears, altered or blood vision, syncope, which is regarded as fainting spell or fainting episode, unstable level of consciousness, unprovoked chest pain or angina, edema, which is swelling, especially on the legs or lower extremities, lack of energy or fatigue, even at rest, breathing difficulty, unexplained irritability or anxiety, facial paralysis, which is expressed in weakness of muscle weakness on one side of the face, inability, which can result to also inability to close eyes, and loss of hearing and taste sensations. There could be blood in urine. Nose bleeding is equally implicated or noticed. Heart palpitation. We get into the risk factors of high blood pressure. Risk factors are major promoters of hypertension, and there we have modifiable and non-modifiable risk factors. Let's understand modifiable risk factors. Modifiable risk factors are factors you can control, and they include smoking, diabetes, physical inactivity or lack of exercise, sedentary lifestyle, those who stay in a place for more than 1 hour without movement, obesity, high blood cholesterol, regular high salt diet or intake of high salt, high quantity of salt, consistent high alcohol intake, and cigarette smoking. We get into non-modifiable risk factors, which are factors that beyond human control, and they include age. In the case of age, it's common that older adults are more hypertensive because blood vessels integrity changes with age. There is issue of gender. Studies show that men are more prone to hypertension than women of the same age group. However, the reverse may be the case during menopause in women. Genetics factors. This is rare, but worth mentioning because genetic motivation, genetic mutations or structural changes can promote hypertension. Family history of heart disease and ethnicity. Research shows that Africans, Caribbeans, or South Asians have high risk of experiencing high blood pressure. Complications of high blood pressure. Hypertension can cause significant complications, which include stroke, myocardial infarction, which is heart attack, heart failure, aneurysm, which is enlargement of arteries, peripheral arterial disease, chronic kidney disease, diffuse arteriosclerosis, which is fatty plaques that obstruct blood flow inside arteries. We have pulmonary aneurysm or embolism, which is sudden blockage of arteries by blood clot, cognitive impairment, and dementia. Dementia is a behavioral disorder that's caused by brain disease. Hypertension can have significant influence on the men and women's sexual health as expressed in erectile dysfunction. Hypertension also contributes to hypertensive nephritis, which affects the kidney. Hypertensive retinopathy, which affects the eye. It shortens the life expectancy. This complications can lead to disability, reduced quality of life, and premature death. We get into prevention of hypertension. Prevention is always better than cure. Let's talk about some effective ways to prevent hypertension and associated cardiovascular diseases. As a matter of fact, lifestyle interventions work best when implemented as a holistic approach rather than isolated changes. Remember, your lifestyle can make your hypertension hard to control, or may even be the real cause of your hypertension in the first place. Taking hypertension drugs without modifying your lifestyle means that while drugs are reducing your high blood pressure, your actions can raise it back. Consulting health professionals provides personalized guidance and support for implementing and maintaining healthy lifestyle to prevent hypertension and promote overall wellness. In order to achieve the desired outcome in management or prevention of hypertension, you need to adjust your lifestyle, especially when aging, when you are 50 years and above, or faced with a family history of hypertension. You need to be very, very careful. Irrespective of gender, you need to maintain healthy body weight. Your body mass index is supposed to be between 20 and 25 kilometers per square meter. You can do that yourself. Divide your weight by your height. That gives you a body mass index. They will know what to do. So practice portion control to maintain healthy weight and prevent overeating. You need to feed responsibly on balanced or therapeutic diet that mainly consists of water and combination of 2 or more of lean protein from such as fish, cereals, nuts, fruits such as avocado and kiwi, legumes like beans, and skinless poultry. These are low in saturated fat and can help meet your protein needs without raising cholesterol level that support hypertension. You need whole grains such as whole wheat, brown rice, oats, and quinoa because they provide more fiber, vitamins, and minerals. Choose low-fat or fat-free dairy products like skim milk, yogurt, and low-fat cheese. They are lower in saturated fat and good sources of calcium and protein. Engage in specially planned regular exercise like brisk walking, jogging, swimming, dancing, or gentle stretching at least 30 minutes per day, most days of the week. You need to reduce dietary intake of salt to less than 6 grams of sodium chloride per day. Choose fresh, whole foods and seasoned meals with herbs and spices instead of salt. Homemade diets are preferable because you can control the quantity of salt you need. Cut down on your sodium intake by avoiding high sodium processed foods, canned soups, fast foods, and condiments. Be mindful of the sodium content of packaged foods and opt for low sodium alternatives. Includes potassium-rich foods such as bananas, leafy greens, sweet potatoes, and tomatoes in your diet. Potassium helps to balance the effects of sodium on blood pressure. Limit the consumption of foods and beverages that are high in added sugars, such as sugary drinks, candies, and desserts. Naturally sweet options like fruits are better. You need to cut down cut down on alcohol intake to less than 150 centiliters per day for men, less than 100 centiliters per day for women. Instead of alcohol, coffee, or caffeine-based drinks, it is better to drink moderately beet juice, skim milk, cucumber juice, tomato juice, hibiscus tea, and grapefruit juice. Excessive alcohol consumption and smoking elevate blood pressure. Avoid smoke from cigarette, or totally avoid cigarette smoking. As much as possible, enjoy adequate sleep for 6 to 9 hours per day on the left side of your body for return of blood to the heart, better return of the blood to the heart. Poor sleep or sleep disorder like sleep apnea, which happens most times when you have shortness of breath for a few seconds while asleep, can increase risk of hypertension. It is very important to keep yourself hydrated by drinking 300 to 600 centiliters of warm water, preferably daily. Water enhances blood flow and circulation, which help to control and maintain good pressure or good blood pressure. Management and control of hypertension. If you are hypertensive or not, don't worry. Applying discussions here offers amazing solution to hypertension challenges. There are several management strategies to control high blood pressure and reduce the risk of cardiovascular diseases. This information on what to do is crucial. It is very essential to reduce psychological stress through such as biofeedback, which is a technique that controls your body functions such as heart rate, breathing pattern, and muscle responses. Relaxation and meditation are very key, are very important. At 18 years old and above, have your blood pressure checked frequently. Do not ignore the symptoms of hypertension. Present yourself early to healthcare professionals for proper screening, investigation, diagnosis, counseling, treatment, control, and monitoring the earliest stages of high blood pressure. You should take drugs such as birth control pills, diet pills, some cold and migraine drugs under medical supervision. Diet and lifestyle modifications can promote high blood pressure control and minimize the risk of associated health complications. However, drug treatment is often recommended for people who are experiencing inadequate or ineffective response from lifestyle and dietary modifications. In conclusion, I have an important question for you. What have you had? Are you ready to use what you have had to partner in your heart health? Remember, hypertension is a serious condition, and if ignored or left untreated, it can lead to severe health complications or challenges. By understanding the risk, making lifestyle changes, and seeking professional help, you can take control of your health and reduce the impact of hypertension in your life. Partner in your hypertension management or prevention today and enjoy quality life tomorrow. Remember, every step you take towards a healthier lifestyle is a step towards a healthier heart. So, stay healthy, and we will see in the next video. Be of good cheer.